Hi, I'm Dr. Richard Lacone at the Antiage Institute, and today we're going to demonstrate the use of dermal filler in the lips and how to shape and revolumize the lip. Today our patient is Caroline, who while she has nicely shaped lips, with passage of time has lost a little bit of volume. Caroline will tell you that when she was younger, her lip was fuller, her upper lip had a little bit more vermilion show, that is show of the pink part of the lip, and had a little bit more volume, and she's noticed these little vertical lines, like accordion lines in the lip. That's due to the loss of volume. Also, patients note sometimes that their lip had more shape when they were younger, in that this little particular curve of the lip that's very pleasing, called the Cupid's bow, loses some of its shape and becomes somewhat flatter and loss of detail. So even though hers still has some, we're going to try to amplify that a bit by again giving a little bit more volume here right in the area of the Cupid's bow, a little more prominence through here, and just give it an overall more pleasing shape. Her lower lip generally has pretty good volume, pretty good what we call anterior projection. So we're going to emphasize and probably really focus in on that upper lip. All right, so we're going to demonstrate how to do the injection. The first thing we're doing here is giving a little relief of discomfort by chilling the lip. This actually works better than anesthetic numbing. It works better than topical cream. And just placing this on the lip for about the count of 10 slowly gives a nice numbing. I'm going to make a little tiny puncture right here, and then we will begin. This is a technique by which you use an atraumatic cannula. Note that this is not really sharp on the end. It's actually quite dull. The idea is it just glides through the tissue and doesn't cut or slice, doesn't damage nerves and arteries, doesn't cause bleeding, and allows us to do this with much less bruising. We've been able to do this, and patients can go out that night in public, whereas in the past, treating the lip with fillers usually resulted in more bruising. As we advance this into the lip, it's also much less prone to cause discomfort because it's not really cutting or severing nerves. It just pushes them out of the way very gently. Now we're going to inject. Just inject and pull back. And we take a look. We got a nice effect here. We'll do it again. The nice part is that each pass of this, we inject a little bit of material which has some anesthetic in it, so the lip becomes more and more anesthetized as we go, which makes it even more comfortable. I think you can pretty much tell by observation that Caroline is really not experiencing a lot of
How does it feel, Caroline?
significant discomfort.
It's really, like, I can hardly feel anything.
That's good. All right.
I mean, that's amazing.
Get a little more volume in there, a little more shape. And we just inject as I pull back. I'm going to put a little extra emphasis right here in the corner to try to achieve this little effect where we turn the corner of the lip upward into, again, a pleasing effect. It's still a little bit part of the Cupid's bow look, where the tip of the bow curls back upward gently in a very pleasing appearance. Okay, so what you can see here is we have made 3 little threads of filler into this upper lip only on her right side. And what you can see is a little bit more volume, a little bit more definition of the Cupid's bow, a little better proportions between the upper lip and the lower lip, more vermilion show, but also we've achieved a little gentle, pleasing turning upward of the corner of the mouth instead of the gentle downward turn that we see frequently as we get a little bit older. Depending on the individual patient, we could put a little bit more here and get even a little bit more of a height of the lip. I think we're going to settle with this for now. I'm going to come to the other side and do the same thing. Make it a little little thread of material here to match the other side.
Mm-hmm.
Come down, put a little bit right in the corner here to get that. There we go. All right, so now to recap, we are finished. We placed an equal volume of dermal filler in each side of the lip, a little bit in the middle to increase the height of the Cupid's bow. We turned a little bit of material in here to turn the corner very gently upwards. This is a subtle effect. We don't want it to appear to be grinning. We just want it to look like a pleasant look. And total time is about 5 minutes.
That looks awesome. I love it. Thank you.